Thank you, Mr. Chair. As a physician and a former director of the Iowa Department of Public Health, I have a variety of questions that I could ask which would take longer than 5 minutes. So some of them I'd like you to answer very briefly. So there is a traditional definition of herd immunity. Herd immunity comes about by having naturalized immunity from contracting a disease and or vaccination. So Dr. Kessler, what is the level of herd immunity to your understanding, please? Very brief.
What is the
At what level of the population has to have immunity for us to have herd immunity and protection? Is that 50%? Is that 60%? I just want a number.
Congresswoman, no one knows, in my view. I don't know the exact number. I can give you estimates of what I think will bring down the number of deaths.
Excuse me, you're asking me?
Yes, sir.
We don't know that for this particular infection. We know it for other infections.
What is typically considered traditional letter in public health for herd immunity? When we talk about measles, when we talk about any other
measles, it's 90%. You get below that, you start getting into trouble.
And
but
Dr.
herd
Walensky?
immunity is due to a number of things. You have to worry about, A, the combination of the vaccine plus...
I understand. Dr. Walensky, I just wanted to brief, because that goes to part of the question, when do we get out of this?
Okay.
The epidemiologic term of herd immunity is 1 minus 1 over R naught. R naught for this virus is somewhere between 2 and 3, but we know with variants that R naught is changing over time, increased transmissibility. So in fact, I think it's changing given the variants.
Okay, thank you very much. And so the reason I asked that question is that you have said that we're a race between vaccinating as many people as quickly and expeditiously as possible as we have the emergence of new variants. As a member of the Doctors Caucus, we submitted a letter to the FDA that the FDA use real-world evidence that we have gained from Israel and the UK in elongating between the prime dose and the secondary dose for the Pfizer and the Moderna vaccine. This would enable us to get as many people possible vaccinated with the prime dose and then within a 12-week span get their second dose. This is especially important as we're opening up to young adults and children. So 16 to 17-year-olds have been emergency use authorization approved for Pfizer, and we know 12 to 15-year-olds, as published recently, have 100% effectiveness. So now that we have a vaccine that's gone on to pause, would you be supportive of asking the FDA to use real-world evidence in order to increase the duration between the first and second dose of Pfizer and Moderna so we can get more people vaccinated? Dr. Kessler, yes or no?
I think it's more complicated than a yes or no, Congresswoman.
Okay, Dr. Fauci.
Same thing. It's a complicated issue.
Dr. Walensky.
It's complicated.
Okay, I'm glad to see you all putting your medical information and real-world evidence on the line to answer that question when we're trying to get as many people vaccinated as possible, as rapidly as possible. Earlier this week, I made a second trip down to the border, and I can tell you firsthand that the number of migrants crossing constitutes a crisis, and we all know that the COVID-19 pandemic is not over. I saw migrants apprehended at 11 p.m. at night who on the next day were on planes with members of Congress. Not that it matters if you're a member of Congress, but just meaning we saw them so we know that this is real. And these migrants are flying all over the country. I had specifically authored and put forward a bill that all migrants be tested at the central processing facility. Dr. Fauci, do you think all migrants crossing our borders from any border should be tested for COVID-19 before entering this country or being sent to other places within our country?
Yeah, ideally that would be the case.
Okay. Dr. Walensky, what are the requirements for U.S. citizens returning home from overseas? Do they have to show proof of a negative test before entering, and what kind of negative test?
They have to show proof of a negative test or having had disease within the prior 3 months to enter by air.
Okay. Are any of you aware of what kind of tests migrants are given and when they're given tests?
Testing is occurring as they leave CBP on the way to ORR facilities.
So typically testing is at their in-facility, so they've been in a central processing facility, transiting, and then sent to a community either by air or by bus to another community and then having testing. So again, I would say, do you recommend that migrants have testing at the border? And if so, will you put forth that recommendation? Dr. Kessler?
Certainly will yield to my colleagues.
Dr. Fauci?
Ideal conditions, you would want to get testing at the border, yes.
Dr. Walensky?
We are working to get testing and vaccines at the border for people eligible, workers as well as people who are eligible.
Well, I'd certainly appreciate your support for my bill to test migrants at the border. Thank you, Mr. Chair. I yield back my time.